Hello, my name is Sarah.
My name is Chelsea. We are students of West Coast University, both pursuing our bachelor's in nursing. Through our time in the program, we've learned many different diseases and disorders that pertains to the public's health. One of the many issues we hear about in today's society is the controversial subject of vaccines. When it comes to the public's health, it is important we put the research in and the results are accurate. One specific study we found had to do with immunizations and if they're related to the Bell's palsy. This study was done by Kaiser Permanente and will hopefully shed light on vaccines.
So Bell's palsy is an acute idiopathic unilateral paralysis of the seventh facial nerve causing decreased forehead movement, inability to close the eyes, disappearance of smile lines, and altered sensation of the affected side. This condition affects many adults, both physically and emotionally, but it can be more traumatic to the younger population. Herpes simplex virus 1 is suspected to be correlated with Bell's palsy. It is speculated that the herpes virus has some connection, but most researchers can't determine the exact cause. Multiple cases reported that Bell's palsy followed after receiving immunizations from influenza and hepatitis B virus vaccines. There are a few cases where it was reported that a vaccine that contained E. coli toxin was associated with Bell's palsy. However, other cases showed that vaccines had no association with the condition. The researchers' aim is to find results of the association in a larger population rather than smaller cases. There was no hypothesis stated within the article, but the researchers shared their results. The study was population-based from Kaiser Permanente, Northern California, which consisted of children ages 18 and younger from January 1st, 2001 to December 31st, 2006. A novel case-centered analytic approach was used to evaluate the association of Bell's palsy and immunizations. Among the selected cases, participants were categorized into 3 different groups: definite, probable, and rejected. Each category had its own criteria. Definite cases included a criteria where it included a diagnosis of Bell's palsy in their chart, signs and symptoms of Bell's palsy, a report absent of head trauma, accidents, and otologic diseases, and no history of neurologic diseases. Probable cases were those that displayed the signs and symptoms, but was never reported. Rejected cases included those with no signs and symptoms of Bell's palsy. The data included only cases who received at least one immunization during an observation of time period of 1 year prior to onset of Bell's palsy. They used a novel case-centered analytic approach for the research. This method uses a backward approach where they observed odds of exposure during a certain period of time prior to the onset of an outcome are compared with the expected odds of exposure during the same risk interval.
From January 1st, 2001 through December 31st, 2006, 977 children aged 18 years old or younger were identified with an ICD-9, which is code for Bell's palsy, as indicated in their electronic records. 119 of these cases were rejected. Some characteristics of these cases would be age, race, sex, and ethnicity of the test subjects. The symptoms that the sample faced were also documented. For example, out of the definite Bell's palsy cases, 61 patients showed laterality of the facial muscles involvement. The results also included characteristics like the time of onset to the diagnosis in the days. All of these characteristics help paint a picture of what results the study would be. Immunization of TIV or HBV vaccine was not significantly associated with the occurrence of Bell's palsy. Other studies have been done on the link of the vaccines and Bell's palsy. Findings reassured patients that few health problems are caused by immunizations. Specifically, vaccines do not aggravate asthma and does not cause Bell's palsy. This study was conducted to find an association between immunizations with TIV, HPV vaccine or any vaccines, and Bell's palsy during risk intervals of 1 to 14 days, 1 to 28 days, and 29 to 56 days following immunizations among children aged 18 years old or younger. There are some limitations to the study. Most children who received the intranasal live vaccine were too small to allow to examine the associations between the immunizations and Bell's palsy. This means out of 977 children, 18 years old or younger, 119 children were rejected as cases to be researched. One strength of the project was the data involved with each case. For example, if there was a family history of Bell's palsy, then that patient was put into a different category. These categories were either like definite or probable cases. This means that the patient showed signs and symptoms of Bell's palsy, then the reason behind it would be due to that family history, not the vaccine. So this also could be considered a limitation to the study because there are many cases that were labeled as probable. So it is important to conduct researches like this one and to continue to understand the risks involved with vaccines. Another strength of the study was the factor of having a large sample size in the study. In addition to the novel case-centered analytic approach used in this study, has several methodological strengths. This indicates that it was a probable case and not a definite case of Bell's palsy. In conclusion, the results of the study suggest there is no evidence that increases the risk of Bell's palsy following an immunization with TIV, HPV vaccine, or any other vaccine with ages 18 years old or younger.
In conclusion, investigating a potential association between immunization with intranasal live attenuated influenza vaccine and Bell's palsy remains an important topic for future research, especially because of the route of the administration of that vaccine. We wanted to research this experiment because vaccines are such a controversial topic, and it is vital that the public are well educated about the benefits and risks of vaccines. Thank you.